talk about facial injuries and what happens once a person gets a facial injury and the resulting dental injuries that happens post facial injuries. Now in our practice, very commonly I see a lot of road traffic accidents or self fall, and when people come to me, they ask me, "Doc, what should I do? I've lost a tooth, there is a swelling in my gums, there's bleeding, I'm worried." Let me tell you, these things are very common, especially when we have road traffic accidents. So the first thing you need to do is, whenever you meet with an accident, first thing you need to see is whether you have had any kind of serious injuries. Second, you should see whether you have lost any of your front tooth, which is a very common thing that happens, losing the front teeth post trauma. Now, if you have lost a tooth and you're seeing it lying around on the road, pick it up, put it in a bottle, preferably in a bottle of milk or saline or plain water, and take it to your dentist. The dentist will examine it. If the tooth is in a good shape, good condition, he will try to fix it back by splinting. If not, if the tooth is damaged, he may give you an alternative option of dental implants. So that way you can get your tooth restored if it is possible. If not, you can always go for an artificial teeth like a dental implant and a crown over it. The other thing we have noticed after facial injuries is usually people get lacerations on their tongue, on their jaws, on their nose. The first and most important thing is to get a CT scan done to confirm whether you have any kind of facial fractures. You need to go and meet a maxillofacial surgeon to confirm that. Once there is a confirmed fracture on the face, that needs to be examined by a surgeon again, and if there is a legit fracture, then that needs to be operated in the operation theatre under general anesthesia. Now the recovery post injury is usually 3 to 4 days. You can get back to your work and rest of the other things after a week, but you need to maintain a liquid diet for at least 3 to 4 weeks, and oral hygiene is paramount. For that, you will have to use some good mouthwash, salt water rinsing and brushing. These are the key post injury.